Hello, my name is Amara Castillo, and today I will be discussing amyotrophic lateral sclerosis or ALS, a fatal neurological condition. ALS affects the nerve cells in the brain and spinal cord, resulting in the gradual loss of voluntary muscle control. This progressive disease leads to significant physical disability and impacts occupational performance. Initially, it is important to understand that ALS progresses over time, worsening to the point where individuals lose their ability to walk, talk, eat, and eventually breathe. There are two types of ALS: sporadic, which account for about 90% of the cases, and familial, which make up the remaining 10%. Now, ALS mainly affects individuals between the ages of 40 and 70 and is more common in men than women, particularly under the age of 65. For unknown reasons, military veterans are more likely to be diagnosed with the disease than the general public. This disease doesn't just appear out of nowhere. It has a significant impact on specific areas of the brain and spinal cord, as I mentioned before. Scarring occurs in the upper motor neurons within the corticospinal pathways, affecting the lower motor neurons in the brainstem and the spinal cord. Furthermore, we see neurodegenerations in the regions like the corpus callosum and the frontotemporal lobe. It is important to know that ALS affects only motor neurons, so senses such as sight, touch, hearing, taste, and smell remain intact. And muscles controlling the eyes and bladder are generally not affected. Regarding mental functions like memory and thinking also remain intact. Moving on to symptoms, ALS manifests itself in several ways. The initial symptoms of ALS can be varied. One person may have trouble grasping a pen or lifting a coffee cup, while another may experience a change in the vocal pitch while talking. Individuals may also experience weakness in the hands, legs, or feet, and this often leads to tripping or falling and dropping items. Other symptoms include slurred speech, difficulty swallowing, muscle cramps, and unexpected emotional reactions. Another typical aspect is the progressive muscle atrophy, which generally moves from the distal to the proximal regions of the body. As for the causes and progressions of ALS, while the exact origins are not fully understood, significant advancements have been made. For instance, mutation in specific genes like the superoxide dismutase 1 gene and environmental factors such as exposure to pesticides or occupations related with electromagnetic fields has been linked to increased risk of developing ALS. Typically, the life expectancy after diagnosis is about 3 to 5 years. In terms of managing ALS, specifically from the occupational therapy perspective, there are several precautions that we focus on. We try to monitor for signs of fatigue and adjust activity level accordingly. We use adaptive equipment to facilitate participation in occupations and maintain safety. And we try to modify or, it is possible, adapt the activities to meet the client's changing ability. For assessment, we use tools like ALS functional rating scales that assess the patient's capability and independence in 12 functional activities. We try to use as well the manual muscle testing to measure the muscle strength to determine the extent of muscle weakness. And lastly, the Vital Index assessment to measure performance in ADLs and mobility. ADLs particularly affected by ALS include self-care, eating, and functional mobility. In self-care, changes in motor and process skill, impaired coordination and postural control, muscle tone, and endurance, affecting activities like using hygiene products, brushing teeth, combing hair, and nail care. As ALS progresses, eating becomes increasingly difficult. Changes in body structures, particularly the weakening of the bulbar muscle, complicate chewing and swallowing. Additionally, diminished grip strength makes it hard for patients to hold or manipulate utensils. In terms of mobility, neuromuscular and movement-related function impairments compromise walking, often requiring changes in motor pattern or adaptation to new mobility aids. Thank you so much for your time and your attention.